Welcome to Portsmouth Hospital's NHS Trust podcast. Today, our guest speaker is Professor Brian Dolan, and he'll be speaking to us about Last 1,000 Days and Ending PJ Paralysis. Professor Brian Dolan, welcome to Queen Alexandra Hospital in Portsmouth. You talk about time being the most important currency for patients. Can you please explain to us the concept of last 1,000 days?
Last 1,000 days it came to me when I was talking to a group of elder care physicians, nurses, therapists, managers, 10 years ago now this month in June 2008. And I was talking about waste and all the wastes that there are, not just in health, everywhere, over-processing waste, over-production, inventory waste. And one of the biggest wastes is awaiting waste, is wasting people's time, wherever they are. But one of the great wastes is by wasting patients' time. And it struck me that, if you're a woman, you can expect to live to the age of 83. If you're a man, you can expect to live on average to the age of 79. But if you are a 76-year-old man or an 80-year-old woman, what you have is 1,000 days. And what that leads to is a construct about valuing patients' time as the most important currency in healthcare. Because every day somebody spends in hospital longer than they must is stealing their time. And sometimes I think we treat old people as if they've got all the time in the world. But to my mind, they're the ones who are in a hurry. And 1,000 days is a metaphor, in a manner of speaking, to capture the construct that it is time that connects everything in healthcare.
Professor Dolan, very inspirational. Could you just describe to us what ending PJ or pajama paralysis is?
Patients that come into hospital, they get into their pajamas and they're kind of paralysed in their pajamas, still the daily leave, or gowns. But what we now increasingly recognise is that being in bed is actually quite harmful. If you're 80 and you spend a week in bed, you will lose 20% of your quads power. That's some power, the muscles that help you stand up. You will lose 1.5 kilos of muscle, and you will lose 10% of aerobic capacity. Your fitness goes down. You're 5 times more likely to end up in a care home. There's any number. That's 10 years of muscle aging to a person over 80. But it's not just 80-year-olds. Even children. After the London attacks last year, I was talking to a good friend of mine, Lucy Butler, who's the director of nursing at the Royal London. She had boxers who had been attacked, and they were saying, I'm fit, I'm an athlete, but I'm losing muscle. I know it. I feel I'm losing conditioning. So NPJ paralysis is it's a vehicle to prevent people losing muscle tone, losing deconditioning. But the other part of it is this. By getting up, getting dressed, getting moving, and ideally getting dressed, what it means is people are getting back their dignity, their autonomy, their sense of self. And we know it works for patients. And when it works for patients, it always works for staff too. And it's become a global social movement with over 250 million impressions. And it's in Canada, Australia, New Zealand, Ireland and the UK and elsewhere. And bit by bit, it's like all social movements, it's word of mouth, and it just makes sense to people. And you don't, whether you're a healthcare assistant or a chief executive who wants to, who goes on a ward round and would like to help people in a meaningful way, actually anyone can do this because it takes sense. And the group we underestimate the most, the group with the greatest resource in healthcare we don't tap into, and that is patients and carers. And it's how do we ensure that they are part of that conversation too.
Professor Brian Dolan, thank you.